The following is a Samsung production. It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Folks, for months we've been talking about omega-3s, we've been talking about fish oils, and you know yours truly has been taking the fish oil. This is Omega Flex, folks. It's from LifeGuard. This is another show. We're going to talk about the fish oils and omega-3s. Interesting stuff, folks. We have testimonials here. People have been taking this particular product. And, of course, I got the pro, the one and only Dr. Michael Gross, my co-host, who is the Chief Medical Officer for LifeGuard Health. And we have a special guest, folks, no stranger to all of us here in the state of Pennsylvania and now in New Jersey, Dr. Tom Meade, who is an orthopedic surgeon. Let me just review something with you, Dr. Gross. We're talking about the omega-3s and the fish oil, the importance of what it does. Sometimes we get new viewers in and they're a little confused. Everyone in the world knows now, I think, why fish oil is good for you. But let's talk about the omega-3s and let's talk about fish oil and review a little bit. Let's revisit some of the reasons why fish oil is so good and what it does for the system.
Well, Sam, let me first say it's great to be back with you again and talking about a subject which is so important. And you've actually started at a key issue, which is that fish oil and omegas are not the same. And we'd like to think that our LifeGuard products are the essence of fish oil. This is not what people buy in the Sam's Club or in the discount store. This is a pharmaceutical grade, highly potent, highly concentrated form of fish oil, which is distilled down to its essence. And within fish oil, what makes it work are essential fatty acids, omega-3 essential fatty acids, EPA and DHA. And when we say essential, the viewer should understand that there are certain nutrients that your body cannot make or store that are required for normal function, normal physiology. And when we say essential, that's what we're describing. So every day it is essential that we consume certain nutrients, and omega-3 essential fatty acids are part of that array. So we need a certain amount every day, just like we need a certain amount of oxygen in the air that we breathe. Fish oil that people buy over the counter, it's not that it's bad, but it's low potency. It's really what we throw away. It's in an unnatural form. Mm-hmm. It's poorly absorbed. It's doing some good, but in order for folks to get the amount that they need, Sam, on a daily basis, you need about 2 grams of EPA and DHA on a daily basis. They'd have to take 30 or 40 or 50 or 60 of those over-the-counter fish oil capsules a day. People buy those because they think it's less expensive to do that. So one of the points that we're trying to make is that it's more expensive, and when you get a pharmaceutical grade like LifeGuard that's highly potent and highly concentrated, and we're trying to get the benefits of fish oil, we can do it less expensively because it only takes 3 or 4 of our capsules to get the required needs.
We talked about the the omega-3s and what the product does, okay, with this fish oil does. Now I'm an endorser because I've been using it. To visit with my viewers out there, when I start using the fish oils, and I happen to use the fish oil plus we use the other two, which we'll talk about. It's called the triple play, and I think it's fantastic. I told you after 3 weeks. And I've been doing this talk show since 1994, and I don't talk about anything that I don't personally endorse, and I endorse this because it's fantastic. I noticed that my aches and pains in the morning were like almost eliminated, okay? And you said, well, Sammy, that's just part of it, okay? Where do you get your cholesterol checked? Where do you get your blood pressure checked, okay? And so then we start getting involved as to what happens in your body, inflammation in your body, and why this pure omega-3s that you have, okay, work in that respect. Okay.
Sam, I like addressing a certain principle I've mentioned on other shows, a principle called Occam's razor, which is all things being equal, the simplest solution is often the right one. In America, we believe that It's inevitable as we age that certain diseases will develop. High blood pressure, high cholesterol, arthritis, aches and pains, losing our marbles, and dementia and Alzheimer's. Yet when we look at other cultures around the world, we do not see this. And one of the basic differences between our cultures and these are the fact that we are out of balance with our omega consumption.
Okay. Now, getting to this product, folks, I want to just tell you something, okay? If, I use this, I happen to use the Flex, and we're going to talk about the different products. But I want to tell you something. When you smell this, it's fantastic, and it's pure stuff. It's non-contaminated stuff. I have here some testimonials, okay? And Dr. Gross does a radio show every week and gets tons of testimonials. In the Hazleton market, I have to tell you about one of the pharmacies, Heights Terrace Pharmacy. There are a number of people who have been going to the pharmacy buying the product, and as I'm talking, we're going to scroll some of the pharmacies that you can get them at, plus the 800 number or the 888 number that you can call. But here is a person, is a testimonial, okay, all true testimonials on cholesterol, okay. I eat well and watch my weight, but my cholesterol has increased a lot since I've gotten older. Both my mother and father had the same problem. I didn't want to go on any prescription statin because I watched my mother have difficulty with sore muscles. I decided to try LifeGuard's Omega Cardio Triple Play. After just 2 months on the LifeGuard products, my cholesterol has been reduced to the point that my cardiologist just wants me to keep doing what I'm doing. Thank you, LifeGuard Health. Lucy from Pottstown. Now, there's a gentleman in Hazleton. I was talking about this Heights Terrace Pharmacy, where he was totally amazed at what happened when he started taking this. And this is, again, this is only cholesterol. We're going to get into orthopedics in a minute, but what happens here? What's so great that all of a sudden the cholesterol starts dropping down? And then I start feeling so great in my life here at the age of 43.
What we've done here, Sam, is attack the problem at the root cause. Cholesterol and the overproduction of cholesterol is a result of inflammation in the body. It's actually, in this case, inflammation of the cardiovascular system and blood vessels, which we call vasculitis. And the body makes cholesterol to try to repair the injury that's occurring in the cardiovascular tree as a result of inflammation. So omegas are nature's natural anti-inflammatories. And instead of treating it one symptom at a time, as doctors often do, throwing a statin is like throwing a bucket of water on a forest fire. We are treating this at the root cause. We are decreasing inflammation throughout the body, which is why it has so many effects like you're feeling. So in the case of cholesterol, this comprehensive approach, the omegas will reduce triglycerides. We have that other product up there, which is red yeast rice and CoQ10. That's our LDL reduced product. That is a natural statin and will reduce the bad cholesterol, LDL cholesterol. And the no-flush niacin. Niacin has been around. It's a vitamin. We've known since 1953, Sam, that niacin therapy will elevate good cholesterol. It's just that niacin causes a flushing reaction. So we've come up with a no-flush form of niacin. So with this comprehensive approach, we attack the total cholesterol issue, and we do it better than any prescription medication without the side effects that person was so worried about.
Dr. Tom Meade, one of the probably one of the top orthopedic surgeons in the United States. Tom, you're having your own show, OAA, and doing very well with it, I must say. The orthopedic benefits of omega-3, okay, tell our viewers, our bones, our knees, our joints, etc. What are the orthopedic benefits of this particular product by LifeGuard? And folks, as we're talking, I'll scroll the pharmacies and also the number. They have a call center about these particular products, and you'll know what I'm talking about. Okay, Tom?
Sam, thank you for having me on and as a guest. I enjoy being with my good friend Mike Gross today. Your question is very pertinent, but you've actually answered it in your opening monologue, if you will. Sam, you sound it exactly as most of my patients do in the office after taking omega-3 fatty acids, a pharmaceutical-grade fatty acid for 3 or 4 weeks. The feedback is exactly as you have stated. They come back and their aches are less, their pains are less, and I have a practice that's very, very specific to knees. I limit my practice to degenerative conditions or traumatic injuries in the knees. So I may see 5 to 10,000 patients in 6 months with knee arthritis. So I get this feedback all the time, and it was overwhelming. About 2 years ago, what pushed us as orthopedic surgeons into using omega-3s was the crisis with the medications that most people were being prescribed for arthritis. The COX-2 inhibitors, if you will, the common names were out there on the market, the Vioxx and those type of medications. And what happened is there was tremendous side effects. Our first rule was to do no harm. And indeed, some of the data showed that they had an increased chance of heart attacks and strokes. And so right away, that violated our Hippocratic Oath. And we took a lesson from history. For 200 years, patients have been using fish oil to treat arthritis. It goes back to cod liver oil in England.
Well, what happened? That thing stopped and went crazy. Now we're back to that.
It tasted terrible. They had to be forced into taking it, so they had to be on their literal arthritic deathbed to take it. And what happened is they got it from the rotting livers of codfish, and it did have EPA and DHA. They just didn't know what were the active ingredients that were the anti-inflammatory. Now we have distilled down and drilled down into that cod liver oil, and we realized that the EPA and the DHA does not smell or taste like fish, so we're able to refine it and give it to our patients now, and we have a natural anti-inflammatory that decreases the pain of arthritis without the side effects of ulcers, heart attacks, or strokes.
You know, the more I do these shows and the more I take the omega-3s, and the more I hear people every day, someone stops me in the greater Hazleton area, Wilkes-Barre, Pennsylvania, or wherever I'm at, when they see the show with Dr. Gross, and they're saying, you know, is it really, well, you know, because I had a lady call me with cholesterol. She's on these pills. Her muscles are similar to what this girl called about, and she said, you know, started on the omega-3s, and all of a sudden, you know, she's starting to see a difference. I mean, they're like little miracle drugs here. The people are using aspirin and the over-the-counter stuff, and we're talking about NSAIDs, right? What are NSAIDs?
NSAIDs are non-steroidal anti-inflammatory medications, the general class of drugs that you can buy over the counter, the ibuprofens, the Motrins, the Aleve, those sorts of things. And you know what, I'm very honest, Sam. I'm very honest with my patients, and it sounds like a miracle drug, and frankly it is, but it's sometimes a overt miracle drug like you, or your pain goes away, but I don't wave the flag out there telling everybody that your pain is going to go away absolutely, because you know what? It may not. If you give somebody high-dose steroids, you could almost guarantee them that their pain will go away in 24 hours, but the risk is not worth it. They can die from that if they take it for 30 days in a row. So the omega-3s will reduce arthritic pain in a significant number of people, but if you're at the end of the waterfall, it may not decrease it enough to avoid, you know, some issues, but the side effects of omega-3 exist. There are side effects to everything. You know what the difference is? The side effects are good. For the first time in my career, the side effects are positive. They don't cause ulcers or heart attacks. You know what they do? They decrease ulcers, they decrease heart attacks, they decrease your cholesterol, they decrease depression, they decrease your chance of Alzheimer's disease. With that, really, there's no reason I can't promote that, even if their arthritic symptoms don't go 100% away.
I mean, this is fascinating stuff. I mean, it's for the viewers out there. I mean, sometimes I know they go to the channels and they're listening. Folks, I'm telling you, this is fascinating stuff. We had lunch today and with Dr. Philip Benyo, okay, who also does a show with Samson Productions, SSP TV, and we talked about the benefits and what, you know, the medical doctors are now, at least in this case, Dr. Benyo, but the importance of this is now you gave him a sheet or some information as to what the doctors now have to do to get reaccredited. Will you discuss that a little bit, which I found very interesting?
Sam, this is a reflection of the changing medical model now. As the population ages, we can't just deal with patients one symptom at a time, one disease at a time. We've got to start thinking about that old saying, an ounce of prevention is worth a pound of cure. Otherwise, we're just going to have a nation full of sick people. So what we're seeing now finally is an emphasis on prevention in terms of therapeutics, training of medical students, and doctors who've been out there, as I have and Tom has and Dr. Benyo, are now learning about attacking these things at the root cause with what we would call nutritional therapies. Now, I just want to build on what Tom said for a second. Here, we have a product here, Omega Flex, and now we know that the Omega science, for example, has evolved to a point where if we formulate these natural products in a certain way, we can enhance the pain-relieving benefits of the Omegas and still get all those wonderful benefits that Tom said. But this is not a drug. It's not going to, you give it to one pill and the pain's going to go away. It's got to build up in the body. We're basically restoring a balance in the body that should have been there all along. And once we've done that, not only do we help people with their pain, their blood pressure goes down. So many other conditions are improved because we're giving them the essential nutritional therapy that they need to be healthy.
Now, what I'm going to tell you, folks, I'm going to highly recommend you've seen the pharmacies that are you can get the product at, but there's an 888 number there that you should call. And what I use the Flex, and I use the LDL, and I use the HDL, okay? And now there's the other two, the cardio and mind. Now, you said something, these three have the same things, but a little extra juice for, the mind, if someone's older and the Alzheimer's and breaks certain plaques down or whatever, and then the cardio. But basically the three are the same, okay? But only what we say a little extra juice. And of course these two. I call this the triple play, folks. That's what I use, and I got to tell you, I'll probably get hit by a car, but I mean, I'll be in good shape, I mean, I just think let me read this to you, okay? This is about blood pressure. How many of us are worried about our blood pressure? My blood pressure was 106/60 the other day, and then it went up then it was during the day when I'm in the television studios, it's like 120/80, okay, or 130/75 or 80. I think that's pretty good for being a guy 27 years old. I'm only lying. My husband, this is lowering blood pressures. Actual testimonial, folks, okay? And the phone number's up there, folks. I encourage you to call, okay? My husband was so worried about me and my high blood pressure, especially after my dad had a stroke, okay? He was sure that the same thing would happen to me. I took blood pressure medication, but I just couldn't find the right combination of drugs to keep it low enough. Then my doctor recommended LifeGuard Health Omega Cardio Triple Play. Not only did my blood pressure normalize, but I stopped getting headaches. We can relate to that, folks. I feel good, and George doesn't have to worry about me anymore. Pauline from Chester, Pennsylvania. Now, we had the testimony with the girl with diabetes, okay? And now, Tom, getting back to you, okay, as we are getting older and living longer, thank God, the benefits of omega-3s, okay? When do you think... what age group do you think people should start with the omega-3s? And assuming 50s and 60s or 70s, okay, give me your feel on that. Because some people say, I'm too old for this, and they're like 65. Then some say, I'm too young, I'm 28, okay? Give me your feel on that.
Sam, you know what, that's a great question. My answer may startle you.
Okay.
Not only can you not be too young, these food substances are given prenatally right now. They're given to pregnant women because it's very simple. As Mike said, there's two components of omega-3, the EPA and the DHA. And if you want to simplify things, EPA is the anti-inflammatory component, DHA is the brain food. Okay, so let's think of it in that regard. The young prenatal mother, the American diet is horrendous now. We do not have the appropriate substrate for normal brain development. Some people think that is a major contributor to things like learning disorders and attention deficit disorders. Therefore, DHA is put in all infant formula. So you can't be too young for it. And frankly, some of the schools around the country, including Texas, are putting it in the school lunches to decrease the amount of Ritalin the kids have for ADD. On the elder side, let's just take the other end of the spectrum. On the other end of the spectrum, your grandmother and grandfather should have it, because even people with advanced Alzheimer's disease can improve their function tremendously by taking high doses of omegas. Most people don't take enough, and they don't know what they're taking, they don't know the quality. But even 85, 90-year-old people that were basically household bound or wheelchair bound in long-term nursing facilities were given high doses, 10 times the normal amount, and all of a sudden they woke up, they smiled, they played cards, they spoke to their family like they never spoke before. Athletes are taking this, and I get on my high horse, I get so excited about it. This is a strong statement coming from me. This is the single biggest advance that I've come across as an orthopedic surgeon, the single biggest non-surgical advance that I've come across in my career. I'm that excited about it.
Well, I got to tell you, I mean, when I was very fortunate to meet him through you, and we talked about this, you always think, well, there's a little gimmick involved, etc. But then when I heard of the reputation of this man, this great man here in the Philadelphia market, and the successes he had in the medical field and what he did, I figured, wait a minute, anybody who has this reputation is not going to push a product just as a gimmick. And then your input, okay, and it's a miracle. I mean, really, this stuff is a miracle for people, and there's nothing bad. That's what I'm saying.
Sam, this is in the news every day, and it's not just orthopedic surgeons or perinatologists. Another example is neurosurgeons. One of the chief neurosurgeons at the University of Pittsburgh puts every low back patient and disc patient on it. The neurosurgeon that was in charge of the Sago mine disaster, there was only one survivor that had tremendous brain injury because he had carbon monoxide poisoning. Well, you know what? They put him on 18,000 grams of fish oil a day because of the brain food component to it. And you know what? He's up walking around, and his wife is pregnant with a new child. So it did something right.
I say to you folks, if you want to give somebody a gift, you go to one of the pharmacies that are scrolling on a screen, or call that number, and you give them a gift of this. You give them the triple play. You cannot go wrong. You are going to do something for a friend or a family member that's unbelievable. Okay, I take it religiously every day, and it's been just, thank God, has been fabulous to me. And for doctors to say that, I'm surprised that what you're saying about the gentleman with the 18,000. It's amazing. It's just amazing.
Yeah, it's absolutely amazing.
As medical providers, as healers, we sit here, Tom and I, and we spend so much of our careers dealing with one issue at a time, one symptom at a time. Tom, no one can fix a knee better than Tom, and I'd like to think that I help bring a lot of great babies in the world. What we've lost as healers is the ability to do something that helps the whole person. And that's why Tom and I are so excited. This is something that is so essential to every cell, every physiologic function in the body. It amazes us that it took so long for us to discover how many good things this does. We want the American public to be aware about this, and someone's got to make the best product, and we'd like to think that we've done that here.
Well, I've heard the expression, and we started this before in the beginning, well, you mentioned this in the beginning of the show, well, fish oil is fish oil. It's not fish oil is fish oil. There is a major difference, folks, between this stuff and the stuff that you get over the counter. Major difference, okay? Not contaminated, pure. It just has a lot more. But someone says to me, well, some people out there who have high blood pressure, that's all they're concerned about right now. They're not concerned about because their cholesterol is good, or diabetes, or rheumatoid arthritis, or whatever the case may be. They're already, but as soon as you mention one concern, and it helps them, what they don't realize, and this is the exciting thing, Mike and Tom, all the other things that are happening in their system, that's great, okay? It's all the pluses that, I'm just concerned about my blood pressure, I'm concerned about my cholesterol, okay? But all the other stuff that's happening is just fantastic, it's just fantastic. I mean,
Sam, sometimes when we sit and talk like this, we think it strains credulity, which is why we come back to that simple axiom that sometimes when all things are being sorted out, a simple solution is often the right one. So this is so simple. It's so essential. How would our bodies function if we didn't have oxygen in the air? Well, this is just as essential. Without omega-3s, so many of our normal functions are compromised. When we add this back into the human equation, we function better. All of our faculties are restored. When we look at other cultures that are in omega balance, they age better than we do. They have less disease than we do. There's no reason that aging has to be something that involves chronic disease and disability. Tom and I like to think about life not only in terms of longevity, but the health span. How many years are you going to be healthy? I want the viewers out there to know that if they're in omega balance, if they would be taking our products, the number of years of good health would be much enhanced.
Folks, if you just tuned in, you're watching the Sam Lesante Show. We're on SSP TV, and you can go to our website at ssptv.com, and you can get this show at any time you want because it's archived. You could also Google it, and you could go to Yahoo, and you could also just put LifeGuard Health, and you will be able to see the show. I say this because this is so important. You may have friends anywhere in the United States or in the world that can get this product, and you know people out there that need it. So Dr. Michael Gross is my guest. He is the Chief Medical Officer for LifeGuard Health, and Dr. Tom Meade is one of the nation's outstanding orthopedic surgeons, and we have some high-powered people here talking about a simple thing. I want to tell you, if you just tuned in, I use this stuff myself, and I'll tell you, I've been around a long time doing this show and had a reputation that I want to maintain. This stuff has been great for me. I used a triple play, and triple play is, to explain the triple play for people who just may have tuned in.
Triple play is really a cholesterol message. We want people to understand that. Everything starts with the omegas. We may be treating with the omegas certain disease entities at the start and ultimately get folks into omega balance. Part of that has to do with reducing triglycerides, which are part of the cholesterol profile, but we have to think about LDL cholesterol, lowering that, and elevating HDL cholesterol. That's why we have the triple play.
You know, Tom, I want to address something here. There are a lot of people that are obese. Okay, they don't mean to become obese. It just happens in their life, and their attitude sucks, and because they're fat. You know, they don't know what to do. What about, how does this help this obesity epidemic then?
Well, it's a great question because most people understand if they eat poorly and they get heavy, it can cause heart disease. But if you tell someone if you eat poorly and you get heavy, it can worsen or cause arthritis, and they look at you in a confused state. When you are heavy and above your ideal weight, the logic is that the extra weight acts as a lead weight or bricks in the car and it's going to wear your tire out. And that's true, but it is amplified and magnified by this simple fact that the cells that hold the fat not only weigh a certain amount, Sam, but they have a chemical called arachidonic acid, which is a very, very active chemical in the body. When that breaks down, it causes inflammation and inflammatory hormones. Very simply, the fish oil turns it off. That's how the fish oil works in the heavy person to avoid or decrease inflammation and arthritis.
Dr. Tom Meade, thank you for coming on the show. Dr. Gross, this is a continuous series, folks, that we have here with the Sam Lesante Show featuring Dr. Michael Gross, who is the Chief Medical Officer for LifeGuard Health. Give a gift of health, folks. Call the number, stop in the pharmacies, and you'll know what I'm talking about. We'll see you next time on the Sam Lesante Show.
This has been a Samsung production.